Welcome to Lesson 3.1, Activities of Daily Living, or ADLs. As a care partner with Agnes and Sandy's Caring Hands, assisting clients with everyday personal care activities may be one of the most important parts of your job. However, caregiving is not simply about completing tasks for someone. Your responsibility is to provide safe and respectful assistance while helping clients maintain as much independence as possible. Throughout this lesson, we will discuss common ADLs, appropriate assistance, client dignity and privacy, recognizing changes in a client's abilities, and proper documentation. Activities of daily living are the routine tasks people perform to take care of themselves. Depending on the client, a care partner may provide reminders, supervision, standby assistance, or hands-on assistance with these activities. The amount of assistance required will vary from client to client. Always follow the client's current care or service plan. Never perform a task simply because you believe the client needs it if that task is outside the client's approved services or outside your authorized duties. One of the most important principles of personal care is promoting independence. If a client can safely wash their face, allow them to wash their face. If they can button most of their shirt but need assistance with the last few buttons, assist only where necessary. Doing everything for a client may seem helpful, but unnecessary assistance can actually reduce independence over time. Give clients reasonable time to complete tasks and encourage participation without rushing, criticizing, or becoming impatient. Not every client who receives home care requires the same level of assistance. Some clients may simply need reminders. Others may require someone nearby because of weakness or fall risk. Some clients may require hands-on assistance with certain activities. The client's care plan should identify the level of assistance required. Do not increase, decrease, or independently change the client's level of care without reporting the change to your supervisor. Bathing is an especially important ADL because it involves both safety and personal dignity. Gather supplies before beginning so you do not leave the client unattended unnecessarily. Make sure the floor is dry and the bathing area is safe. Check the water temperature before the client enters the shower or bath. Maintain the client's privacy by keeping doors and curtains closed and keeping the client appropriately covered whenever possible. Bathing also provides an opportunity to observe the client's skin for redness, bruising, swelling, sores, rashes, or other changes. Report concerning observations according to agency procedures. Clients have the right to participate in decisions regarding their care, including refusing assistance. For example, if a client refuses a scheduled shower, you may calmly encourage the client and explain why bathing is beneficial. You may offer to assist later if appropriate, but you must never threaten, intimidate, argue with, restrain, or physically force a client to complete an ADL. Document the refusal accurately and notify the appropriate supervisor when required. Dressing is another opportunity to promote independence and personal choice. Whenever possible, allow clients to select what they want to wear. Clothing should be appropriate for the environment and should not create unnecessary safety hazards. Remember that your personal preference is not the client's preference. If the client's clothing choice is safe and appropriate, respect their decision. When helping someone dress, explain what you are doing and avoid unnecessary exposure of the client's body. Personal grooming is about much more than appearance. For many clients, maintaining their normal grooming routine helps preserve dignity, confidence, and a sense of normalcy. Encourage clients to participate whenever possible. Follow infection control procedures and never share personal grooming equipment between clients. Care partners must also remain within their authorized scope of duties and agency policy when providing grooming or personal care services. Toileting and incontinence care must always be handled professionally and respectfully. Never embarrass, shame, joke about, or criticize a client because of incontinence. Provide assistance promptly whenever possible. Follow standard precautions when exposure to urine, stool, blood, or other body fluids is possible. Proper hygiene is especially important because prolonged moisture can contribute to skin irritation and breakdown. Report concerning changes such as unusual urine color, blood, diarrhea, severe constipation, new incontinence, skin breakdown, or significant changes in toileting patterns according to agency procedures. Some clients may require assistance during meals. Always follow the client's care plan and dietary instructions. Make sure the client is positioned safely for eating and encourage them to feed themselves whenever possible. Never rush a client through a meal. Pay attention to coughing, choking, repeated throat clearing, difficulty chewing, difficulty swallowing, or other unusual behaviors. If a client appears to be choking or experiences an emergency, follow your emergency training and agency procedures immediately. Mobility includes walking and moving safely throughout the client's environment. Before assisting, know whether the client requires supervision, standby assistance, or physical assistance. Remove obvious hazards from walking areas. Clients should use their prescribed assistive devices, such as walkers or canes, according to their care plan. Never encourage a client to walk without required assistance simply because they appear stronger that day. Changes in mobility should be reported. Transfers involve moving a client from one position or surface to another. Transfers can create significant fall and injury risks for both the client and care partner when performed incorrectly. Always follow the client's care plan and use required equipment. Never attempt a transfer that requires more assistance than you can safely provide. We will cover transfer techniques and safety requirements in much greater detail during Lesson 3.2. Personal care can place clients in extremely vulnerable situations. Imagine needing another person to help you bathe, dress, use the bathroom, or clean yourself after an accident. How the care partner behaves can make the client feel respected or humiliated. Knock before entering private spaces. Explain what you are going to do before touching the client. Keep the client's body covered whenever possible. Speak respectfully and professionally. Never discuss a client's personal care needs with unauthorized individuals. Because care partners spend significant time with clients, you may notice changes before anyone else does. A client who normally dresses independently may suddenly need assistance. Someone who normally walks steadily may suddenly become weak or unsteady. A client may stop eating normally or become unusually confused. Do not diagnose the client or attempt to determine the medical cause. Observe, document objective facts, and report significant changes according to agency procedures. Documentation must accurately reflect what occurred during your shift. Do not simply document that a bath was completed if the client refused the bath. Do not document that a client walked independently if you provided hands-on assistance. Never copy information from a previous shift without confirming that it accurately reflects what happened during your own shift. Your documentation should be factual, objective, timely, and complete. This is an example of appropriate documentation. Notice what the care partner did not write. The note does not say that the client was difficult, stubborn, lazy, or uncooperative. Those are subjective judgments. Instead, the note explains exactly what occurred, what assistance was offered, what the client decided, and that the appropriate person was notified. That is professional documentation. There are several behaviors that are never acceptable during personal care. Never force care. Never shame a client because they require assistance. Never rush a client simply because you want to complete your tasks faster. Never ignore safety requirements or the client's care plan. And never falsify documentation. If you encounter a situation you cannot safely handle, contact your supervisor rather than attempting something outside your training or assigned responsibilities. The correct answer is C. A new change in strength or ability to perform an ADL can be significant. The care partner should recognize that something has changed and follow agency procedures for reporting it promptly. The care partner should not diagnose the client. Depending on the symptoms and circumstances, emergency procedures may also be required. An easy way to remember your responsibilities when assisting with ADLs is the word safe. Safety comes first. Assist the client rather than automatically taking over. Follow the client's care plan. And encourage independence whenever it can be done safely. These principles should guide every personal care interaction. Before completing this lesson, make sure you can answer these 5 questions. A DL stands for Activities of Daily Living. Clients should never be forced to complete personal care. Clients should be encouraged to perform tasks they can safely complete because maintaining independence is an important part of quality care. Significant changes should be documented and reported according to agency procedures. When a client refuses care, document what was offered, the client's response, what actions you took, and who was notified when applicable. You have completed Lesson 3.1, Activities of Daily Living. Remember that assisting with personal care is about more than completing a checklist. Every interaction should protect the client's dignity, safety, privacy, choices, and independence. Follow the care plan, stay within your assigned responsibilities, observe changes, report concerns, and document the care you actually provided. Next, we will continue Section 3 with Lesson 3.2, Safe Transfers and Mobility Assistance.